Aortic regurgitation can occur due to damage to the aortic wall as well as due to dilatation of the aortic root so that aortic wall leaflets fail to co-opt. The latter condition occurs in annulo-aortic ectasia, often associated with Marfan syndrome. Aortic regurgitation due to valvular damage can occur in rheumatic fever. A bicuspid aortic wall can also become regurgitant as age advances. In the yesteryears, tertiary syphilis was an important cause of aortic root dilatation and aortic regurgitation. Aortic regurgitation is quantified in terms of regurgitant fraction, which is the fraction of left ventricular output that regurgitates back. It can be assessed by Doppler echocardiography as well as angiocardiography. Aortic regurgitation leads to a high systolic pressure, low diastolic pressure, and a wide pulse pressure. Most of the physical signs of aortic regurgitation are due to this wide pulse pressure. The pistol shot sounds over the femoral, collapsing or water hammer pulse, retinal arterial pulsations, locomotor brachii, and dancing carotids are some of them. Severe aortic regurgitation leads to dilatation of left ventricle and left ventricular failure. When the left ventricle fails, end-diastolic pressure rises and leads to elevated left atrial pressure and pulmonary congestion. Symptomatic aortic regurgitation needs aortic valve replacement. Aortic valve replacement can be done using mechanical or bioprosthetic valves. Mechanical processes requires lifelong anticoagulation, while anticoagulation can be discontinued after an initial period in bioprosthesis. Another novel technique for aortic valve replacement, especially in children, is pulmonary autograft, known as Ross procedure. Homograft replacement of aortic valve can also be considered in places with homograft banks. Availability is often a problem in case of autografts. Left panel shows continuous wave of aortic regurgitation jet. Below the baseline, forward aortic flow is seen, while above the baseline, the tongue-shaped aortic regurgitation jet is seen. Apical 5-chamber view in the right panel shows color Doppler image of aortic regurgitation with a wide mosaic jet originating from the closed aortic valve into the left ventricle. From the extent of the AR jet into the left ventricle, it is moderately severe AR.